This is turning out to be one of the best conferences I've facilitated or emceed in terms of timekeeping. Can you please applaud yourselves? We had intended to give you up to 2:15, but everybody is here and we want to roll, we want to go. So thank you very much for making the time. And I want to say, normally when someone is going to eat, we say bon appétit in French. I'm learning my French. So I'm told that after eating, you say bon après appétit. Like after, après. Oh, it's bon digestion. Bon sieste. I think I got that. All right, so I want us to settle down in the room. For those who are still standing, please take your seat humbly. I want us to be able to kickstart this session. It's a very interesting one. I want to show you. I've just looked at the composition of the panelists, the speakers here. Very, very interesting. And so I want to request that we all take our seats, and then I'll be able to call the moderator to come up. But do me one favor. Not yet. Do me one favor. Just on your feet, everybody. Just stand up. Just stand up, please. Just stand up. Especially when I heard the word siesta. I think we should stand up a bit. Who's seated? Just stand up, please. Yes, stand up, please. Please stand up. I want us to go back to school just for a moment. Kindergarten for that matter. And I want us to write, but we're going to write using our bodies. The whole body. So I want us to write or spell the word ICR, and we're going to do one word at a time. So let's start, not one word, one letter at a time. Can we start with I? Not like this. Down. That's I. Sorry? Yes, so they are seeing how you are a good student or a bad student. So let's go. I. Let's go. C. R. Okay. One more time. That was warm up. Let's go. I. Some people are cheating. C. R. Okay, I forgive you. Sit down, guys. Sit down. I'll look at that recording and I'll know who cheated. It's now on record. All right, so allow me now to bring on stage the moderator for this afternoon session. And she's a co-author of the ICR report, Care, Economy, and Business Environment Reforms. She's now an Holly Lad Kruger. Let's appreciate her as she comes to take over.
Hi, everyone. Good afternoon. I'm delighted to be here. As our very energetic moderator said, I am Holly Lard Kruger, managing partner at the Canopy Lab, which is a boutique consulting firm specialized in economic empowerment. And I'm also the co-author of the Investment Climate Reform Facility's recent study on the care economy. This study explored current trends in care policies, including childcare and parental leave policies in Africa, the Caribbean, and the Pacific. And as he said, I will be your moderator today. I wanted to open with why I'm here. I was drawn to researching the care economy because it allows for the development and fulfillment of human capabilities and potential, and it makes all other forms of work and well-being possible. Simply put, it is a fundamental part of the global economy. Yet, despite its centrality to our existence, care work and care economy more broadly has long been excluded from economic policy discussions. And it is only recently gaining the attention it has long deserved from policymakers, the private sector, and development partners. For those of you who may be unfamiliar with the term, the care economy, it consists of labor and services that support caregiving of all types. It includes value chains that rely on care workers, such as healthcare and domestic care and childcare, as well as infrastructure, services, and technology that enable the delivery of care. And as a working mom with a young daughter, the topic of care resonates with me personally. In fact, my partner and I had to make special arrangements for her care while I'm here with you all here in Kigali, and he is in Berlin at another work conference. But beyond personal anecdotes, there is empirical evidence from the Africa, Caribbean, and Pacific region that there is a positive relationship between care policies and economic outcomes. In fact, research has found that care policies to close the gender employment gap stand to increase the GDP of countries by 20%. Unfortunately, shifts in demographic, socioeconomic, and environmental contexts in the Africa, Caribbean, and Pacific context are increasing the demand for a supportive care economy. And this is creating an important opportunity for ACP countries to formulate high-impact care policies. Our research found, however, that to optimize economic outcomes of care policies, they must provide for affordable, accessible, and quality childcare services, and they must also challenge gender norms and increase awareness and benefits for the whole family of shared responsibilities between fathers and mothers through conducive parental leave policies. While the case for care policies is clear, our research shows that this is a topic that is new and challenging for governments to address. And this is particularly because of the lack of data and the cross-cutting nature of the topic, which requires a highly consultative, multi-stakeholder approach. In today's session, our distinguished speakers will elaborate on how they are overcoming the challenges associated with developing and implementing childcare and parental leave policies by sharing their own experiences and lessons learned. I can assure you that we are in for a very exciting session. We will kick off with a presentation from the Technical Vice Minister of Women's Affairs from the Dominican Republic. She will share their experiences implementing a national care policy and piloting care communities. Her presentation will be followed by a panel discussion, which will explore from different stakeholder perspectives several of the key findings of our study on the care policies. This will be followed by an audience Q&A. I will now invite the Technical Vice Minister of Women's Affairs from the Government of the Dominican Republic for her presentation. Vice Minister Then, the stage is yours.
Hello, how are you? Are you awake? Yes? So thank you for joining this panel about care economy, and it's a pleasure for me to be here and to share a little bit about the experience that we are developing in the Dominican Republic with the care policy. We have only 3 years working with this policy, so let's keep in mind during the presentation because it's an ongoing process. And as I say in the morning, we learned a lot from the COVID pandemic, and this is one of the results, how we are pushing to advance in the implementation of this policy. Okay, here some geographical information about Dominican Republic, where we are. We are in the Caribbean. We are in a small island developing state, and we share the island with Haiti. Our population is more than 10 million of people, and we are considered by the World Bank, I have a colleague from the World Bank here, as a upper middle income country. And our GDP per capita is a little bit more than 100,000 of US dollar. And some picture about Dominican. Here you can see a Dominican boy. Because why a Dominican boy? If we're gonna have a conversation about care policy, and care policy have to take care of the girls and boy. Here we have a boy. We are asking about equality, right? And some beaches, our beaches are very famous, and tourism is one of our main economic activity. Also, we have a very important colonial zone in the Dominican, and this is the first cathedral in Latin America and Caribbean, which is located in Santo Domingo, and some picture about more cultural, our music, merengue. You know merengue? Yeah, my colleague from the Caribbean. My colleague from Jamaica. Okay. And then, why does Dominican need a care policy? We have a population which is not satisfied with care demand, insufficient coverage of care service from children from 0 to 5 years, low public offer and center for people over 65 years age, and there is not public offer of home care. Not any public offer of home care. Unequal care of share, as I mentioned in the morning, on women is the main barrier to participate in the labor market. I say in the morning that a recent study that run by the Ministry of Economy say that more than 100,000 of women are not able to access the labor market or to develop their business idea because of the domestic responsibility. And another reason is the need of cultural change to promote redistribution, co-responsibility in the home regarding with the responsibility. So this cultural change is probably one of the most complex duty that we have, but we see this as one of the need and as one of the responsibility that we have when we are promoting a policy care, a care policy. Okay, Dominican Republic is promoting a national care policy that has the following objective. The first is to generate a care economy by taking advantage of the potential of care as a social investment, the creation of the new job. And the way that we see from the Ministry of Women is that those jobs have to be decent and also job not only for women, but also for men. Because the care worker, we are not supposed to be only women in the care market, but also to have a man and access for men, for opportunity for them. And also another objective is to promote a society of care, ensuring right to people who demand care. And we have target which people in this early state of the policy, which people we are focused on through this policy. So now we are developing like a pilot project, a community of cares. And through this community, we try to involve and to have a participation from different sector and an institution. The pilot of the care community that we have, we are developing two pilots, one in a rural area and another one in an urban area. So Asua, which is more rural, and Santo Domingo in the capital and urban area. The main sector, who are the target population that we are trying to attain through this care policy? Children from 0 to 5 years, elder people over 65 years, and also people with disability in dependency situation. Those three population are the target that we have in this early stage of the policy. How we are doing the coordination between the different public institutions that have responsibility to run the policy. We have the Ministry of Economy, Planning and Development, also the Ministry of Women, Superate, which is a program in charge of the social service. And also we have the Ministry of Work, party institution working with children, people with disability, and also the National Office of Statistics, and Infotep, which is an organization focused on training for workers. Maybe you say, oh, a lot of institutions, and this is one of the challenging part when we are designing a policy and designing a system of care. Who are the institutions that have to be involved in this progress and in this kind of policy? And also in which state of the policy we have to involve other institutions. The institution that I show in the previous page are like the main institutions that are involved right now in the pilot project. And also we have like three organizations that are leading the policy: the Ministry of Planning and Development, the Ministry of Women, and also Superate, the program Superate. And the institutional structure that we have to coordinate among the different institutions is an intersectorial care table. And a couple of commission to divide the responsibility through for the implementation of the policy. We have a technical team, and I mentioned here that in the technical team, we have some space for civil society and non-governmental organization, which is an important actor in this policy. Then we have a different commission, one governance commission that have to organize the meeting and the different agreement that the organization take in the intersectorial table. We have a commission in charge of the training and certification. This is very important commission, because one of the first activity that we made for the implementation of the policy was to generate a curriculum for care workers. We didn't have any previous offer of training in terms of care, how to care people with disability, how to do it in a professional or technical way. So one of the main of the first tasks was to develop this care training. And we have a special commission that work with this program, and we already have some results. And also we have a commission that meet the institution that have existing care service, even if they don't necessarily have the vision, but we start to work with them, and now we have some of the institutions that increase their capacity and the offer to give service, even if the service is not domestical, it's not at home, but we have some experience with center, for example, to take care of the child between 0 and 5 years, and also a daily time center for elderly people. And we also have a commission in charge of the caregiver networking. So it's a way to organize the first promotion or cohort of people who is working through the opportunity that the policy is already generating. And also we have another commission in charge of the information production. This is important because of the data generation before of the implementation and during the implementation is necessarily to support the process and the decision making. And other commission related with local plan, which is very important. As I mentioned, we have 2 pilot community in rural and urban area. So in those community, we also have like a local table, which is composed by local organizations like local authority, local NGOs, and the representation of the governmental institution at community level. So we have different actors with different roles, but it's very important because those people in the local commission, they receive direct the impact of the policy implementation in the city and also in the community, and also the challenging that we are facing in this early stage of the implementation of the policy. And also we have a regulation commission to organize the work and also looking for the future, how we have to continue to organizing, generating rules, thinking about the possibility of low care in the country. So it's an ongoing process, and how to regulate the opportunity that we are generating, and also to having present why we are doing that, which is how to guarantee the right of the people to be cared, which is the main reason of the policy. And here some idea about what we are doing, but I already mentioned some of the idea. How I'm going with the time? Good? Okay. I want to highlight, for example, in terms of training and certification, actually we have more than 1,000 people that already received the training, and they are able to work and offer service at domestical level. So this is one of the advance that we have. Curriculum, and we already have 1,000 of people who participate in the training, and they are ready to work, and some of them are already involved in the implementation of the policy. And what else? I mentioned some of the action. Well, I want to highlight some of the existing care service, some of the institutions that had previous service before we start with the implementation of the care policy. They, after this discussion and after this vision of how much we need to expand service, they innovate with other kind of service, and they expand the offer of service that they have. It's happened with INAPI, which work with children between 0 and 5 years, and also it happened with CONAPE, an organization who take care of elderly people. So now they are increasing in the community, in alliance with civil society organization, a model to offer service in like a different center in the community. Even if we are not ready, if we don't to give the service at home level, but we are doing our best in diversifying the service at least at the community level, with the amplifying those centers for children and people and elderly people. And the Ministry of Women, we have a different role in the national care policy. And one of the roles that we have is to coordinate with the Ministry of Economy and Development and heading the care intersectorial table. As I mentioned, 3 institutions are leading the implementation of the policy. And the Ministry of Women is one of those 3 institutions. And something that we are doing all the time is like to keep in over the table the vision of the right of the people to be cared and the right of the women to have through this policy a different opportunity to access to the labor market and also even to have a free time, because it's about the right. It's not only this economic perspective, but it's the right that women have, like to make different activity and not only to have time for care responsibility at home. So it's one of the view and perspective that we as a Ministry of Women always have present in the discussion with other institutions, with international organizations that are supporting the implementation of the policy. And last one is where we are going. We are planning to the expansion of the existing care service for the next 4 years. Our government plan have the target of implementate this policy in 10 communities. Now we are working in 2 communities. So the idea for the next 4 years is at least 10 communities. Also, to implement the implementation of the public offer at home care is one of the biggest challenges that we have, and we also have to see the condition of the home. I mean, it's not only the policy, the worker, but where the care worker gonna do their work. What is the condition that the family, that the people have at home to receive this support? Also, to continue the professionalization of the care work and thinking about promote a legal reform to improve the working condition of the care worker. And thank you. I'm going to be here for the panel and ready to share with you and to answer any question or to listen any recommendation from the room about this experience that we are developing in DR. Thank you.
Thank you so much, Vice Minister. I think your presentation really brought to life a lot of the findings of our study on care policies, the multi-stakeholder, the multi-layered approach. And I also really appreciate for you bringing in that human angle. Often we talk about economics, businesses, but there's also humans at the end of the day that are central to this. So thank you so much. I want to now take the opportunity to invite the rest of our panelists to join us on stage. Mr. Bemi Joseph Sese, he is the Assistant Director at the Gender Affairs Directorate in Sierra Leone. Ms. Marina Elefante, she is the Private Sector Development Specialist at Women, Business, and the Law at the World Bank. And Mr. Isaiah Imaya, he is the founder and CEO of Uthibiti Africa in Kenya, and he is the co-founder for the Collaborative Action for Childcare. Thank you. I'm going to kick off this session here with the first question to Ms. Elefante. Women, Business, and the Law is a World Bank Group project examining the laws and policy mechanisms affecting economic decisions women make as they go through different stages of their working lives. Over the past decade, you've looked at 8 indicators related to areas such as assets, mobility, and entrepreneurship. And recently, in this latest edition, you've added 2 new indicators, one on safety and the other on childcare. And I know that you'll touch on the safety indicator in a later session, so I wanted to ask you, why did you talk about the childcare indicator? Why did you include it? And what are some of your findings for the Africa, Caribbean, and Pacific region?
Okay, thank you, Ollie, and good afternoon, everyone. Yes, so we know that women have the power to turbocharge the global economy. We have heard this morning and this afternoon already how closing the gender gap for women's participation in the workforce could add 20% to the global GDP. However, there are still gaps in the participation of women in the economy. So as I was saying, there are huge gaps in the participation of women in the economy. And so why is that? What keeps women out of the workforce? Could the law have anything to do with it? And this is what we set out to measure at Women, Business and the Law. And as Holly mentioned, we look at different areas. We look at women's mobility, her rights at the workplace or in marriage or as parents. Now, on this particular point, traditionally, we measure the laws and regulations providing maternity and paternity leave. But what happens after that benefit ends? And we know that women are disproportionately responsible for the care of children at home. And this unequal distribution of care responsibilities really prevents them from accessing jobs, retaining jobs, or often relegates them into lower paying jobs or in the informal sector. And so we understood it was clear that childcare was an important component for women's economic participation. And this all came about during the COVID-19 pandemic, when all of a sudden it was clear to everyone how balancing the care of kids at home and work was extremely challenging. And so this is why we decided to expand our research and include this new indicator on childcare. This is an indicator that measures laws and regulations to make childcare available, affordable, and of good quality. And so when it comes to our finding in the region, the ACP countries as a group, unfortunately, do not perform very well, with some notable exceptions. We have data for 74 out of the 79 countries in this group, and we score countries depending on how conducive their legal framework is to the participation of women in the economy. And so as an average in this group, the score for the laws on childcare is 19 out of 100. It means that only 19% of the laws that would be needed to be in place to support women when it comes to childcare are really there. And if we look at implementation mechanisms, the score is 5 out of 100. So it means that we need those mechanisms, those policies to implement. But as I said, we also have examples of good practices. We have heard about the Dominican Republic, so I won't repeat, but I can give you the example of Mauritius, which together with the Dominican Republic is one of the best performing economies in this region. Mauritius implements a crash scheme that provides that government pays an allowance to register daycares that admit children of vulnerable families. That's an incentive for the admission of these children into registered daycares. It also pays a one-time grant to daycares that upgrade their quality standards to meet the registration standards of the Ministry of Gender and Family Affairs. And the tax income law provides that employers that make an investment to set up daycares for the children of their employees can deduct twice the amount of that investment from their taxable income. So as you can see, these are measures that are meant to make childcare more affordable for the providers and in turn also for the families to make the quality better. This all promotes uptake, and that's what we want, so that women can use these services and go back to work or start working after having children.
Fantastic. I really appreciate how you're able to bring evidence and data to a lot of things that are difficult to quantify. This next question is for you, Mr. Bamey. Out of 100, Sierra Leone scored 72.5 on Women, Business and the Laws report, ranking higher than the global average of 64 and higher than the sub-Saharan regional average of 57. And in 2022, Sierra Leone passed the Gender Equality, and Women's Economic Empowerment Act, also known as the GWE Act, which includes provisions for maternal and paternal leave policies. Could you tell us why you focused on these care policy areas, and what do you believe will be the impact for women's economic empowerment and the broader business environment in Sierra Leone?
Thank you very much. It's an honor to be here. Good afternoon and greetings from Sierra Leone. After extensive and comprehensive consultations, research, assessment, and feedbacks with various stakeholders on critical issues such as discrimination, gender inequality in employment, as well as training, and underrepresentation of women in leadership positions, there was a recognized need to promote gender equality, to support families, and to enhance child development. These processes highlighted the significance or the importance of developing parental leave policies and legislations to empower women economically and to promote a balanced, divided caregiving responsibilities. The focus on these parental leave policies and legislations is to ensure we're able to address challenges faced by women and their families in balancing their caregiving responsibilities and work without losing their jobs. In 2022, Sierra Leone passed a groundbreaking legislation known as the GWE Act, which is the Gender Equality and Women's Empowerment Act. It extended maternity leave from a period of 12 weeks to 14 weeks. In the subsequent year, we also enacted a very important legislation known as the Employment Act 2023, for which provides 14 weeks, 12 working days paternity leave for fathers. So you come to realize and come to understand that as much as we want to provide maternity leave for women, mothers, there's also a paternity leave for 14 working days. So it's a period of 2 weeks. And then we really want to see how we can be able to address these challenges faced by women so that at the end of the day, they'll be able to balance their work responsibilities and that of their work commitments. And I want to believe, parental leave policies and legislations have what I believe is significant impact when it comes to women's economic empowerment and that of the business environment as a whole. To start with, it allows women to prioritize their family well-being as well as taking care of other things without fear of losing their jobs. For instance, you can imagine a woman, who have a paid-up maternity leave. At the same time, she's taking care of her family. And then she feels good, she feels happier, and then she'll be able to become more productive within the workspace. Additionally, you come to realize it helps a lot in terms of improving maternal and child health care. Let's say, for example, if you have a woman who have access to maternity leave, that woman will be able to bond with the child, that woman will be able to participate with the upbringing of the child, that woman will be able to seek medical attention or medical help, and which will help both mom and baby stay healthier. Also, it also makes provision for fathers to support moms during their child upbringing. So fathers will have opportunity through paternity leave to support moms to ensure they're able to participate in their child upbringing. And then within the business environment, I also want to believe the impact is also huge because at the end of the day, businesses, companies that offer paternity leave or maternity leave to working parents does not only show commitment to their well-being, but will also enhance what we call productivity. It will increase loyalty as well as boost their morale. So I think it has a huge impact for women's economic empowerment as a whole and that of the business environment.
Thank you so much. It's clear that Sierra Leone has already connected the dots on different child care policies, parental leave policies, and greater women economic empowerment and business environment productivity. This next question is for you, Mr. Amaya. With your organization, with Abiti Africa, you work to accelerate quality and affordable childcare in Kenya and have founded the Collaborative Action for Childcare, a platform that gathers both government and non-state actors to advance collective action and impact within the childcare ecosystem within Africa. And in Kenya, you have effectively worked with national and local government to advance childcare policies. Could you share with the audience why you felt it was important to engage with public and private sector as well as civil society? And what does this look like in practice?
Thank you very much. Can you hear me? All right. It's a pleasure to be here with a fellow man talking about childcare and care policies. And I think it's a privilege I do not take for granted. So in Kenya, when we started 5 years ago, the first question was, how do you achieve the fastest possible change within an ecosystem that has a lot of women who are underpaid or not paid sufficiently and whose rights are not being observed by government and communities? So we thought the best solution is collective action, and collective action that brings together all stakeholders to the table. So we deliberately got government involved, the private sector, civil society organizations, and caregiver groups themselves to start organizing and addressing the issues affecting the childcare ecosystem. The reason for that was that we felt that, and we know that Africa right now faces a childcare crisis. There are very few countries with policies for children 0 to 3 or 0 to 4, depending on context, and their caregivers. And therefore, we thought that it was very, very important to test methodically, based on evidence, strategies that can work at local level and at national level. And we've done that in Kenya over the last 5 years. And thereafter, we thought these are scalable. And we are starting the scaling up of this in Malawi through practical policies at community level, but also working with the national government to design and implement care policies that can be implemented a little bit more quickly, because children are not waiting. And also the rights of millions of caregivers in Africa are being downtrodden. So we believe it's a women's rights issue, it's a women's economic empowerment issue, particularly because Nairobi, for example, has about 10,000 childcare microenterprises supporting over 150,000 children, and government doesn't even recognize these childcare workers. And we believe that they're playing a very important part in the economy, and they have to be supported.
Wonderful. I love this. Children are not waiting. I can speak from experience on that. Technical Vice Minister, then, in your presentation, you mentioned the importance of working collaboratively and especially cross-ministerially. And I know one of the key roles of the Dominican Ministry of Women's Affairs is to mainstream a gender approach across other governmental policies and institutions. Working in a cross-ministerial fashion is also something that came up in our research on care policies recently. I wanted to hear from you, what does this look like in practice in the Dominican Republic when you're working on care policies that affect other ministries? And what advice do you have for policymakers in the room?
Thank you, Holly. Make-sure is always hard. It's challenging, but we are doing through this policy mainstreaming gender and in other policy. And something interesting is that we have a legal mandate to work in the public sector, in the planning process, to have this gender approach in the planning of things of the different institutions. Also, we are working with the Ministry of Finance to have gender-sensitive budget, and one of the tasks that we already designed to identify the public investment in care is a particular task for public budget, which is addressed for the implementation of the policy care. But also, we are doing monitoring of the implementation of the policy. And we achieved to have indicators in the different systems that monitor the public performance to ensure how much the planning take into account the gender approach, the use of the gender tag in the institutional budget, and using the monitoring system to generate qualification to the institution. But it's not easy, we have to recognize, because an important part of the job is to educate, to offer training to the institution and how to do it and how to use the tool that we have as the gender sensitive budget, and how to use a specific tag to identify which service is related with the policy, what is the particular investment that we are doing. The institutional structure that we have for the implementation of the policy, it also helps the continuous contact with the organization. And I want to highlight that to have mechanisms for the advancement of women at the level of the ministry is important to ensure high-level dialogue. And if we are talking about equality, we also have to see this to figure out the equality in terms of the institutional framework. What kind of mechanisms do we have in our different countries to ensure the women advance? So something that helped in our case is that we already have 25 years with the mechanisms for the advance of women at the level of the ministry.
I want to pick up on your point around data, because I think that's a great segue for my next question to Ms. Elefante. In addition to adding 2 new indicators, the latest Women, Business, and the Law report has introduced measures to evaluate laws and policy implementation. There are now scores for supportive frameworks and expert opinions for each indicator. How have these new analytical lenses shaped your understanding of the current state of childcare and parental leave policies, particularly in the Africa, Caribbean, and Pacific region?
Thank you, Ollie. Yes, so since Women, Business, and the Law started 12 years ago, the comment that we have received more frequently, time and time again, is, yes, you measure laws, but what good are laws on the books? And that's an extremely valid point. A well-drafted law that is not effectively implemented is pointless. Like to say, it's like writing a letter and not mailing it. It does not achieve the outcome that it is meant to achieve. And this is why this year we decided to expand the scope of our measurement to look not just at the laws on the books, but also at those instruments, mechanisms that are important and needed to implement the laws. This could be policies, it could be procedures, it could be institutions and budget allocations and data. And so for childcare in particular, this allowed us to look at childcare laws from the perspective of the users and the providers. So, okay, there is this well-drafted law on childcare that says that childcare should be made available publicly or privately, or parents are entitled to financial benefits, but I am a parent in need of childcare. Where do I go? What are the options that are available to me? Where do I request this financial assistance? And so this is exactly what we look at. Whether governments publish or keep a database or a registry of the available childcare centers with all the registration requirements, admissibility requirements, contact information, so that parents can know what options are available. We look at the ease of application for financial benefits, whether there are clear application procedures, including online applications for both parents and providers to request financial benefits. And when it comes to the quality of childcare, We look at whether governments publish reports on the quality of childcare centers, quality standards. And I can give you some examples from within the ACP region. For example, Jamaica publishes a database of all the daycare centers that are available. In addition to that, it is the only country within the ACP region that publishes a report on the quality of these childcare centers, which is the result of the investigation and inspections conducted by the Early Childhood Institute. And the only country within the ACP, and keep in mind that globally only 28 countries have this kind of report. Or, for example, the Dominican Republic, together with Antigua and the Seychelles, these are the only 3 countries in the region that have clear application procedures to require financial benefits, including online applications. When it comes to parental leave policies, traditionally we only looked at the law and whether laws mandate maternity and paternity leave in line with the ILO standards and whether these costs are supported by the government. But from the implementation side, we are also looking at the ease of application for these benefits through one single application process, at incentives for fathers to take up leave, which is not very common. Sometimes these leave are available, but fathers do not take them, and the availability of sex disaggregated data on unpaid work. And what we find is that no country in the region provides incentives for fathers to take up leaves. We have 3 countries, Congo, Rwanda, and the Central African Republic, that provide a clear application process through one single government process for mothers to apply for this benefit for maternity leave. And Rwanda is one of 5 economies that publish sex disaggregated data on unpaid work. All of these data are important for evidence-based policy making and for the implementation of these policies. So it really changed the way we look at these policies and laws.
Definitely sounds that way. I want to bring in Mr. Bami from Sierra Leone. As Sierra Leone has recently introduced new care legislation, could you share with the audience what measures you have put in place to ensure quality implementation of this new law?
There are a number of measures put in place to ensure we have a successful implementation of the GWEE Act, that of the Employment Act. Interestingly, most of these measures, or some of these measures, emanated from the Act themselves. For example, the Act mandates the Ministry of Gender and Children's Affairs to establish a National Steering Committee for compliance and monitoring of implementation of provisions in the Gender Equality and Women's Empowerment Act. So what we have done as a nation, Sierra Leone have established this National Steering Committee, and the committee is the highest body. It oversees compliance, it ensures, it provides monitoring for ministries, departments, and agencies to comply with provisions in the law. And this National Steering Committee constitutes representatives not below the rank of a director from various ministries. Also, the Act mandates the Ministry of Gender and Children's Affairs to establish gender focal units in various ministries. So what we have done again as a nation, we have been able to identify with consultations with line ministries to get focal points, and these units have been identified. These focal points have been trained on gender mainstreaming. So the expectation is that they go back to their ministries, they integrate gender considerations into their sectoral policies, into their plans, into their activities. And then, like what the Vice Minister mentioned during her presentation, she spoke about regulations. There is no way we can implement parental leave policies and legislations without regulations. Regulations are very much key. So what we have done as a nation, we have developed regulations for implementing the Employment Act 2023. That regulation has been approved by Parliament, and it provides guidance, like a roadmap, as to how we can get the provisions in the Act being put into practice. As I speak here in this conference, currently there is an ongoing consultative workshop in my country to develop the regulations for the Gender Equality and Women's Empowerment Act 2022. So we have stakeholders brought together, CSOs, NGOs, to look at how we can be able to implement the GIWI Act successfully. So we're going to have ideas on table, and then we'll be able to come up with a very good regulation. And then lastly, we look at capacity building. You know, a lot of trainings have been conducted, a lot of workshops have been conducted as well to educate officials, to educate employees, to educate other civil society organizations on the importance or the benefits of provisions in the GIWI Act and that of the Employment Act. So a lot of awareness raising have been conducted. So these are all measures we have taken as a nation to ensure we have successful implementation of the two legislations, the GIWI Act and the Employment Act 2023.
Thank you for sharing that. I want to bring back in Technical Vice Minister Then. The Dominican Republic is 3 years into this work, and you are now preparing for the next phase of your program. With the benefit of hindsight, is there anything that you would have done differently? And what are you thinking about for this next phase?
Thank you. Sure. We have a few ideas, but something that we learned that is important to probably to manage in a different way is how we communicate to the people. What is the policy about, the process, the benefit that people in the community, that the family will receive. Because the announcement of a policy like that generate a lot of expectation for people, for family. So when we are working, many of my colleagues in the community level, they receive the comment, the expectation from the people. What's going on? we need a care. We have people with disability. We have people with particular condition at home, and we are expecting the policy to start. We want to receive the benefits. So how a complex policy like this one communicate the complexity of the process, and that probably we, as we are doing, thank you, we start to deliver the service to the center in the community. But some of the family, the people need the service in their home, but it takes time to have all the facility, to have all the resources, to have the data, the information, all the information about the family. So it's hard to develop all of the components of the policy in a short time. Oh, it's not working.
Let's try this one again.
It's a plan. And this is one of our learning, that to ensure a good communication, especially for the community that are part of the pilot, how to manage the expectation and the progress.
I think that's such an important insight for this group on managing expectations of the people who receive the care, especially taking into consideration the amount of time it takes to develop a well thought out and executed care policy. This is the last question we'll have before the Q&A. It's for Mr. Amaya. I know you seek to expand your work going forward, and that you're building on your successful approach in Kenya and have already started to operate in Malawi. You work with both governments and private sector actors as they are ultimately responsible for supporting the implementation of care policies for working parents. What are some of the emerging lessons from working with the private sector?
First, I would like to appreciate what has been said before. I think policy is important, but without implementation, it's not useful. And there's a joke in Kenya that good policies are developed there but implemented elsewhere in Africa. So with childcare, we really have a robust ecosystem of actors that are doing both practical things and strategic things within the ecosystem. So I'll give an example of the work around workforce development. Just a week ago, we are at a workshop, a national workshop with multiple stakeholders convened by the collaborative action for childcare and the government authority responsible for training, and we are about to finalize that, that curriculum. I think the most important lesson is really government leadership is critical, because in all our work we have ensured that government is in the room and leading the process. And what we found is that when government is leading the process, other actors coalesce around the government agenda and ensure that actions happen both at policy and practical level. Secondly, I think recognizing the importance of organizing for caregivers is really, really critical. When we began our research on the status of female childcare workers in Kenya, we actually decided that as a local community-centered organization, we couldn't just do research and produce a report and walk away. So when we launched our status of female childcare workers report 2023 last year, we also decided to create a network of caregivers in Kenya. We believe across Africa, in every country, there needs to be a network of caregivers, because that alone, we've seen from years of women organizing and advancing their rights. It is a critical, actually, part of the solution. We also believe that the domestic workers, research on domestic work is really non-existent in most contexts. And yet in Kenya alone, there are about 2 million domestic workers working in very unsafe circumstances in private households with their rights actually not respected in law and in practice. The third issue is actually the private sector in Kenya is really, really interested in investing in childcare. We are working very closely with the Kenya Private Sector Alliance to ensure that the private sector, as an employer of many women with next to government, also begins to invest in childcare as a good for as something that's good for business. So in general, we see that because childcare touches all aspects of the economy, a multi-sectoral approach is very, very critical. It cannot be possible that only, for example, one ministry is responsible for childcare. It cannot be possible that only one county government or district government is responsible for delivering childcare interventions. I think we really, really believe that the transformative solution within the childcare ecosystem has to be multi-sectoral. It has to respect the rights of caregivers, and that is essential for accelerating quality, affordable childcare. So for us, we are looking to working with both of you, or all of you rather, in Africa and beyond, because we actually realized when the minister from the Dominican Republic was speaking, I could associate with a lot of what she's talking about. Because actually children are the same across the world. Their needs are the same. Their caregiver needs are the same. So I'm really, really happy to be here, and I look forward to continued engagement with all of you.
I hope today's panel discussion has provoked a lot of questions. We'll now open it up for questions from the audience.
Yes, thank you. Can you hear me? Yes, okay. This question is it's for the whole panel, whoever wants to take a shot at it. As a researcher, there's a lot of new things coming up in evidence base regarding care. This concept of poverty of time that women face with this huge total workload that includes formal, let's say, economic activity and non-paid work, that's domestic and care work. And also this focus on well-being. Now we know from transdisciplinary research the impact on a child's development of having stressed and overloaded caretakers. So I know the policy sounds very focused on institutionalized care, but there's still a lot of care that takes place in non-institutionalized settings, such as households. So my question is, how do you see this new evidence that's constantly coming up, even things like mental load, which is very difficult to measure. How do you see this new evidence sort of interacting with the policy? I mean, the policy will have to change in time as we advance. That's my question.
I might actually direct this to Mr. Amaya. I know you work with a lot of caregivers and have actually seen an opportunity. Women were already providing care services, and you've been working with them, helping them to organize and helping them to take advantage of infrastructures that may have been built by government but underutilized. And so maybe you could take the first question.
Okay, thank you very much. I think the good thing we have is that in most of Africa, the care policies are not yet there. So I think the research is actually helping to advance that agenda. But I think the answer is in the fact that childcare is a complex area, and you are right. There are issues around the psychosocial support of the mothers, and the post-COVID era, there's the psychosocial support of young mothers. For young mothers, for example, there is the isolation that caregivers face in urban Africa. If you were in Rwanda 10 years ago and in Kigali 10 years ago, it's a completely different city now. And that's actually replicated in a lot of Africa. Africa is expanding rapidly, and that means if the caregivers are not organized and connected to each other, it means that if we believe that children can be taken care of in private spaces with untrained domestic workers, then I think we are setting up the future of our continent basically to fail, because research demonstrates that if we don't give the right level of quality of care to children 0 to 3, it's in fact intervening later will not have any impact. And so I believe all the issues you are raising are important, and it's good that research is emerging. But I think the opportunity is really in using that information to draft good policies, but also ensuring that the response is grounded in the truth of the caregivers and the children, and not just policy that's not linked to practice. And that's why, for us, we started our work deliberately looking at both policy and practice. And that is actually bringing up very, very practical experiences on the ground, as well as a policy at a higher level.
Thank you so much. I might bring in either representative from the government, from Dominican Republic or Sierra Leone, to provide your perspective, if you'd like.
I think what is crucial into this whole process, like my brother mentioned from Kenya, is about putting policies and practice into context. Because most often we do have the policies, but when it comes to practice, they are not reflective in the things we do or in the actions we take. Yeah. But one important thing that I want us to take into consideration is the aspect of having a safeguarding policies. Because for my country where I come from, what we have done in the area of childcare, we have developed a child safeguarding policy to ensure the well-being and safety of every child who is being placed in those childcare centers. And it is not only about developing those policies, but to as well ensure we put into practice. We do on-the-spot check. We ensure we visit those centers. We ensure we provide capacity building to even staff who are there in those centers taking care of those children, because we believe the security, the well-being of children are of priority and concern to us. So it is important we take into cognizance the aspect of practice and the aspect of policies or ideas on paper.
Thank you. As we're coming close to time, I want to ask one last question to each of our panelists. I hope to leave us with a bit of inspiration, because it is a complex and challenging policy, but one that we see that is vitally important to the health and future of our countries. The Investment Climate Report on Care Policy Trends revealed that most countries in the Africa, Caribbean, and Pacific region are really in the early stages of thinking about the potential of care policies to contribute to women's economic empowerment and broader performance of their economies. As the final word, what would you recommend to policymakers who are at the early stages of thinking about care policies? Mr. Mayo, I'll start with you. We'll go down the line.
All right. Thank you very much. I think what I would recommend is that governments take the lead and invite other stakeholders to the table to advance the childcare agenda. What I can just quickly add that our experience in Kenya and Malawi indicates that there's actually very little resistance to policy and regulatory reform when it comes to childcare. And actually sometimes what's happening is that other institutions such as civil society and funders actually are running behind. So I think in general, I think that African governments, based on that example and also conversations in Ghana, Uganda, is that governments are willing to advance the policy. And as we've seen, governments cannot allocate resources to childcare without policy. So I think the first stage is policy, and then we move on to regulatory reform.
Yes, I want to believe in developing policies. I think the initial stage is to do a wide range of consultations, which will include stakeholders, employers, employees, and even experts in the field. Because at the end of the day, you want to look at the needs, you want to understand the needs and challenges faced by working parents. This is very crucial for the process. And finally, I also want to believe, or rather recommend, that nations or countries should ensure they improve on collaboration. You collaborate with other international organizations so that you'll be able to learn from best practices from other countries, and then that will give you an insight and guidance in developing policies or legislations that speak towards addressing issues around parental leave. Thank you.
Thank you. As my last point, I would like to bring your attention to the importance of data. Of course, this is what we do. Data are important because what gets measured gets done. And so our hope and our recommendation to the policymakers here is to really use data and research for evidence-based policymaking. Data allow you to identify those gaps, but also identify good practices and replicable models that have worked elsewhere and can work in your own context, perhaps. And the gaps that we find in the region are quite important. We have 62 countries where the score on laws is between 0 and 25, and where the score on the implementation side is 0. And so if you are interested in seeing the data that we collect, I would also like to invite you to visit our website, which is wbl.worldbank.org, where you can download our data and case studies by country, so that hopefully the measures that you will be able to implement will be solidly based on evidence and research. Thank you.
Thank you, Holly. First, I want to thank to the ICR facility for the inclusion of this topic in the conference, and beyond that, the inclusion of the care policy in the initiative. I don't know if you plan from the beginning of the ICR facility to have like those jobs in care policy, but thank you for not only for the panel, but the research, the webinars that you are doing regarding with care policy. Thank you very much. It's another way to figure out the opportunity for women economic empowerment. And please give an applause to ICR facility for the vision that they are having. At the governmental level, we need this kind of facility and space and partner to learn from other countries, to have a different idea, tools to improve the work that we are doing at national level. And advice or ideas from our colleague here in the room. it's important to identify the right actors that have to be involved in the policy, in the design process, in the implementation process. To have the right actor in the table, including not only the public institution, but also the citizens organization, the civil society organization, how to involve the private sector in the discussion. It's a duty, it's a responsibility in itself, the right identification of the actor. And the other thing is to keep in mind the right perspective in the whole process. The right of the people to be cared, which is the reason because we are developing this kind of policy. Keeping in mind all the time the right of the people will help us to design a better response from the government to the people. Thank you.
Thank you so much for that last word. I would like to thank Vice Minister Then for her insightful presentation and all the panelists for your contributions today. I know it was very well received. Please note that there will be a coffee break until 3:45 and then followed by another breakout session. The next session in this room will tackle how to create inclusive workplaces for women. I'm looking forward to it. Thank you all, and thanks again.